other common type of C-section would be a stat C-section or an urgent or emergent C-section. In this case, people are pulling wires and cables out of the wall and they are running you back to the operating room really quickly, and it's like a team of people descend on you. It's like SWAT. Some of the reasons for a stat C-section would be acute fetal distress, maybe a placental abruption, a cord prolapse, those emergencies that we talk about in the course. Again, this involves the whole team descending on you and rushing you back to the operating room. If you have an epidural, they could dose you and get you comfortable very quickly, but if you don't have an epidural and it's a stat C-section or a crash C-section, then they are going to put you to sleep. And if they put you to sleep, your partner is not usually going to be allowed to stay in the room, or your support person. And usually the pain control is not the same as it would be if you had had an epidural in place already, or you were a scheduled cesarean section, because they don't usually use Duromorph with a stat C-section. They just put you to sleep. So pain control after a stat C-section without medication on board looks like a PCA pump, or patient-controlled analgesia, which means you have a continuous line of medication infusing and you have a button that you can hit to give you doses as you need it. But typically, patients who get Duromorph during those labor turns cesareans or those planned C-sections have a much more comfortable initial recovery. I'm not going to hold you. A stat C-section can be very traumatizing, okay? So I do advise, if you do have a stat C-section, that you go ahead and have your therapist on the line for post-op day 3, like when you get discharged home. And if you want to know more, follow me.